Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC Examination. I'll share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts.
Chapter number 15 Medicine 6 questions. This will cover numerous specialty specific coding scenarios as well as immunizations, biofeedback, dialysis, central nervous system assessments, health and behavior assessments, hydration, medical nutrition, therapeutic and diagnostic administration, chemotherapy administration, photodynamic therapy, osteopathic manipulative treatment, patient education and training, non-face-to-face, non-PCCH services, and moderate sedation. So let's see the first question. Question number 1. Patient with severe strabismus visited the ophthalmologist clinic for a strabismus correction surgery. The ophthalmologist performed the surgery by correcting two horizontal muscles and one vertical muscle in the patient's right eye. The physician then used a transposition procedure on the superior oblique muscle in order to further correct a misalignment. What is the correct way to code for the procedure? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is severe strabismus case. Patient visited the ophthalmologist for the strabismus correction. So, the correcting surgery, 2 horizontal muscles and 1 vertical muscle in the patient's right eye, transposition procedure on the superior oblique muscle in order to further correct the misalignment. So, when you see the codes, you can notice that the first answer, that is 67,311 and 12, available in the all 4 answers. Other than that, 314 and 320 also available. So you can use the elimination method to find the answer. So directly go to the code. Okay, when you go to the codes, you can see this is extraocular muscles 67,311. That is strabismus surgery, recession or resection procedure, 1 horizontal muscle. So when you read the case, you can see the correcting 2 horizontal muscles. So there are 2 horizontal muscles. So the 2 horizontal muscles are listed in the 67,312. 2 horizontal muscles. So this code should be coded. So that is available in B and C. Other than 2 horizontal muscle, you can see 1 vertical muscle in the patient's right eye. So 1 vertical muscle also you have to code. So you can see 67,314. That is 1 vertical muscle, excluding the superior oblique. So 312 and 314 should be there. Again, B and C is suitable. So let's see the other answer. Other one is transposition procedure on the superior oblique muscle. So you can see 67,320 is the transposition procedure. That is on the for the extraocular muscle. So this code should be there. So also the additional note says use 67,320 in conjunction with 67,311 to 380. So any of this code you can use this additional code. So this transposition procedure also should be coded. So the correct answer will be answer B, that is 67,312 horizontal 2 muscles, 14 for vertical 1 muscle, and 320 for transposition procedure for superior oblique muscle. So if you encounter this case in a real working scenario, you have to go to the CPT index. So in the CPT index, you have to go to the strabismus, then go to the repair. In the repair, you can go to the subcategories transposition, that is 67,320, 2 horizontal muscle, that is 67,312, and 1 vertical muscle for 67,340. So again, the answer will be B. Question number 2. An 11-year-old established patient presents with high fever and sore throat. The mother calls at closing time and the office remains open for their arrival. The physician performs a medically appropriate history and examination with low complexity medical decision making. What CPT codes are reported? So there are 4 codes available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
In this case, you had to highlight this is an established patient and mother codes at the closing time, and it is a low complexity medical decision. So when you see the CPT codes, you can see the first code is 99,213 and 212. Only 2 codes. And other code is 99,058 and 50 and 51. So adjacent codes are available. So you can use the elimination method to find the answer. So directly go to the codes. When you directly go to the code, 99,212 is office or other outpatient visit. Here, straightforward medical decision making. But in our case, you can see it's a low complexity medical decision. So 99,213 is office or other outpatient visit, low level of medical decision making. So this code will be the correct code for the first scenario. So you can omit other two answers with 212. So let's check the other codes. Okay, 99,050, that is service provided in the office at times other than regularly scheduled office hours. So in this case, you can see patient called for the closing time and the office is open till their arrival. So this code is suitable. But other codes you can see 951 is office during regularly scheduled evening. 90,058 is services provided on an emergency basis. But this is in this case is a office open for extra time. So correct code will be 99,050. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, you have to go to the office and or other outpatient services. There you have to go to the subcategory of established patient. It will lead you to the code 99,211 to 215. Again, go back to the tabular list and confirm the answer. The second part of the question, you have to go to the office medical services, then go for the subcategory of after hours. That is coded as 99,050. Again, go back to the table list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 3. A 65-year-old patient with decreased hearing decided to undergo bilateral cochlear device implantation in order to restore the gradual decline of his hearing and prevent total deafness. Due to the position of the device and the size of the patient's mastoid bone that was partially occluding the patient's inner ear, the physician performed a modified mastoidectomy. A mastoidectomy was necessary for the completion of the cochlear device implantation procedure. The physician used an operating microscope throughout the cochlear implantation. How would you code for the procedure? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is bilateral cochlear device implantation. Physician performed modified mastoidectomy. Here the physician used the operating microscope throughout the surgery. When you look at the codes, you can see all 4 answers having 69,930 with the modifier 50, and other codes also adjacent codes. So you can use the elimination method to find the answer. So directly go to the codes. When you go to the codes, you can see 69,930 is cochlear device implantation with or without mastoidectomy. So here you can see bilateral cochlear device implantation. So if it is bilateral, you have to use the modifier 50. You can see the modifier 50 is 50 for bilateral procedure. So in this case, you have to use the 69,930 with modifier 50. The code 69,505 is not suitable because it is modified radical. That is mastoidectomy modified radical. This is only coding for the mastoidectomy. But in our case, bilateral cochlear device with the mastoidectomy. So the 930 will be the suitable answer. That is cochlear device implantation with or without mastoidectomy. So when you see the other code, that is 69,990 regarding the microscope, you can see 69,990 is a microsurgical technique requiring use of operating microscope. So list separately in addition to code for the primary procedure. The primary procedure is 69,930 with the modifier 50, and additionally the microsurgical techniques we have used additional code. The correct answer will be answer D. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. When you go to the alphabetic index, this is the implantation procedure. So go to the index of implantation. There you will find the subcategory of cochlear device. It will lead you to the code 69,930. Again, go back to the tabular list and confirm the answer. The second part, that is microscopic surgery, you have to go to the microscope surgical. The subcategory operating microscope, it lead you to the code 69,990. Again, go back the tabular list and confirm the answer. Once you confirm, the correct answer will be answer D.
Question number 4. An 80-year-old patient is seen for a preventive medicine service. As a part of this visit, the physician performs a visual acuity screening using the Rosenberg test and a hearing screening involving responses to varied tones and intensities. Select the appropriate CPT codes for this screening. So there are 4 answers available, all are with 2 codes.
Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
In this case, we had to highlight this is a preventive medicine service. The first scenario is visual acuity screening using the Rosenberg test. Second screening is hearing screening involving responses to varied tones and intensities. So when you look at the answers, you can see the adjacent codes are available. The first code is 99,170, 73 and 74. Second code is 92,550 and 51. So you can use the elimination method to find the answer quickly. So directly go to the code. Once you go to the code 9970, that is anogenital examination magnified. So this is not relevant here. The 1972 is visual function screening, automated and semi-automated. 9973 is screening test of visual acuity, quantitative bilateral. So this is a suitable answer. So you can find C and B are possible. So other two answers you can omit. One, you can see 199, 174, that is instrument-based ocular screening. So that is not used here. So let's find the second code. So when you go to the second code, you can see 92,550 is tympanometry and reflex threshold measurements. 92,552 is screening test, pure tone, AR only. In this case, you can see hearing screening involving responses to varied tones and intensities. So that is coded here, screening test, pure tone, AR only. So the second code will be 92,551. So the correct code will be answer C. So if you encounter this case in a real working scenario, you have to deal with the CPT index. So when you go to the CPT index, first go to the visual acuity screen. Then you can go to the subcategory of automated. It will lead you to the code 99,172 and 73. Again, go back to the tabular list and confirm the answer. The second part of the question, audiology function test, that is the index. Go to the subcategory screening 92,551. Again, go back to the tabular list and confirm the answer. Once confirm the answer, the correct answer will be answer C. Question number 5. A patient with a suspected cardiac arrhythmia was given a routine rhythm EKG with 3 leads in the cardiologist office. The results of the EKG were sent to the patient's primary care physician, who interpreted the results and determined the patient's arrhythmia was mild. What is the correct code for the cardiologist office service only? So there are 4 codes available. Those are adjacent codes. So please take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is a routine rhythm EKG with 3 leads in the cardiologist office. So the question is code for the cardiologist office service only. So there are 2 physicians involved. First one is this cardiologist office physician. Other one is who is interpreted the results. But question asking only for the cardiologist office service. When you look at the answer, you can see 93,040, 41, 42 are available. So you can use the elimination method to find the answer. Directly go to the codes. In this case, there are 2 scenarios involved. One is ECG taken in the cardiologist office, and the report and interpretation done by the primary care physician. So the question asks only the code for the cardiologist office service. So 93,040 is rhythm ECG 1 to 3 leads with interpretation and report. But here the interpretation and report part is not asked for the question. So 93,041 is tracing only without interpretation and report. So this is the correct answer because the cardiologist office only done the tracing part. The interpretation and reporting done by the primary care physician. If you take other code, 93,042 is interpretation and report only. This part is done by the primary care physician. So for this question, the correct answer will be answer B. If you encounter this case in a real working scenario, you have to deal with the CPT alphabetic index. When you go to the CPT alphabetic index, first you have to go to the electrocardiography, then go to the subcategory of rhythm. Go to the rhythm and go for the tracing. It will lead you to the code 93,005 and 93,041. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer B, that is 93,041. Question number 6. Which CPT code represents the endocrinology service for ambulatory continuous glucose monitoring of interstitial tissue fluid, including the physician's reading and interpretation of the report's finding over a 72 hours period? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
In this case, you have to highlight this is the ambulatory continuous glucose monitoring of interstitial fluid, including precision reading and interpretation over 72 hours. So when you look at the answers, you can see adjacent codes are used 95,250, 51, and also 99,091 codes are available. So you can use the elimination method to find the answer. So directly go to the codes. When you directly go to the codes, 95,250 is ambulatory continuous glucose monitoring of interstitial fluid via a subcutaneous sensor for minimum of 72 hours. Physician or other qualified healthcare professional provided equipment, sensor placement, hookup, calibration of monitor, patient training, removal of sensor, and printout of recording. So here the second part is 95,252 is analysis and interpretation of report. So this code includes the previous codes part up to this semicolon. So ambulatory continuous glucose monitoring of interstitial tissue fluid via a subcutaneous sensor for minimum of 72 hours, analysis, interpretation, and report. So here you can see the physician read and interpretation of the report. So the correct code will be 95,251. So there are no need of any other additional code. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, go to the index of glucose. There you have to go to the subcategory of interstitial fluid. In the subcategory of continuous monitoring, it will lead you to the code series of 94,242 to 51. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer C.
So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel, and if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.